Good afternoon, everyone, and welcome to AdviceMedia's webinar this month. We're excited to have everyone here, and we welcome you. And we're excited to share the content from today's presentation. My name is Chad Erickson. I'm the Vice President of Marketing and Business Development at AdviceMedia, and we continue to run our series every single month. And we try to find the best presenters with information that's relevant to you to help you manage, maintain, and grow your practice. For those of you who are new, welcome, and just kind of letting you know what our format is. We have our guest today, Jake Dornbush, and Jake is with Formstack. He's going to be talking about HIPAA-compliant forms and how to really make sure that you're compliant and how to really utilize forms effectively as well, and why there's such a need for it. And he and I have been talking for months about this, and been trying to find time to get him in, so it's been great. But whether you're new, first time here, or this is you're one of our regulars, again, welcome. Our format is very simple. We're going to turn the time over to Jake for his presentation here in just a minute. And if you have any questions at any time, I invite you to put those on our questions section on the control panel that you can see. And I will be moderating those. And at the end of the presentation, I'll be able to give those questions to Jake so that he can answer those. So again, we encourage those. We want your questions. Jake is the expert on this. He knows the subject material like the back of his hand, and so he'll be able to make sure that all of your questions are answered. But this, being compliant is absolutely critical to every single practice. Let me give you a little bit of background on Jake. So as I mentioned, Jake Dornbush, he's heads up strategic partnerships for Formstack. He graduated from the University of Wisconsin with a major in international studies and a minor in Spanish. And after college, he began working in sales as an account executive and was selling software, and been doing that for about the past 12 years. But he's now specialized in the healthcare industry for the past 5, and worked with varying companies, different sizes. He knows the space well. He knows the players, and he understands the importance of security. I've learned a ton from him, and I know you are going to today as well. So Jake, I'm going to turn the time over to you.
Thanks so much, Chad. Beautiful introduction. Everybody, really appreciate your time, and hopefully we have some interesting information to share with you today, as well as we'll try to keep it light and fun and not too salesy. The general topic today is maintaining HIPAA compliance in 2019, and I think it's really critical for every practice, large and small, to make sure that, because of the lawsuits, realistically, to make sure that we're doing everything correctly, and that we're doing it more efficiently. So again, want to thank you for your time. We have about an hour. Hopefully, we'll end a little bit sooner than that, so that we can take your questions and get you on with your day. So without further ado, we'll get into a little bit about Formstack. Formstack, just to let you all know, we've been in business for about 13 years. We work with over 25,000 different customers in over 100 countries. And we help organizations, large and small, digitize some of their most time-consuming and tedious processes. So you'll see some of our customers today in healthcare, but we work with small practices, dental organizations, all the way up to Franciscan Health. And all of them are leveraging digital forms. They're kind of getting away from the traditional paper route. Feel free to join the conversation, you guys, today. Forms, you can follow us on Twitter, and just, Chad had mentioned this before, but we are recording the webinar, so you can view this a little bit later, or we'll email it out to you as well. So today's agenda, we're going to just go through a brief history of HIPAA compliance. Then we're going to go through some of the methods of how you can collect PHI or ePHI. We're going to learn a little bit more about the power of digital forms, and at the very end, we're going to wrap it up by filling the gaps and answering any questions that anybody has. So let's first kind of recap, just kind of give a brief overview of what HIPAA compliance is. I know you probably all have heard this a million times, but it's really good to just have a good recap. HIPAA stands for the Health Insurance Portability and Accountability Act. And interestingly enough, HIPAA began in the year 1996. So I wanted to start off a little bit fun and kind of go through what happened in the year of 1996. So just, since it's so far out there, Dolly, the clone sheep, was born. You can see that on the left. And then followed by that, the #1 song in the country was Don't Sleep by No Doubt. Friends was only in its 3rd season. And at the very end there, you can see that President Bill Clinton did go ahead and signed the HIPAA into law in 1996. It was mainly created to improve the portability and accountability of health insurance coverage. So it kind of started out with just insurance. But in 2003, kind of what affects all of us today is the infamous privacy rule. That was added to the law and defined protected health information. So now we're getting into PHI, right? So when I say PHI, that means protected health information. And what that is any information held by a covered entity which concerns health status, the provision of healthcare, or payment for healthcare that can be linked to an individual. That's literally the description of it. The HIPAA, and then followed by that, we're going to talk about the HIPAA security rule that was enacted in 2005, which now regulates ePHI, which is electronic personal health information, right? And so with this, and when we're talking about ePHI, it's specifically talking about protected health information that is produced, saved, and transferred or received in electronic form. So if you guys are working on EMRs or EHRs, any type of information like that or technology, this is what it affects. And to help covered entities plan accordingly and sort of know what's going on, the HIPAA security rule specifies 3 main areas to assure confidentiality, integrity, and the availability of ePHI. Those 3 are as follows. So we have administrative. This is to create policies and procedures. Physical, to control access to areas of data storage to protect against inappropriate access. So that's where we kind of come in, and we'll talk about that later. And then technical, to protect communications containing PHI when transmitted electronically over open networks. Okay, so there is a whole gamut of stuff, and it's not very interesting, but it's kind of where we're at. I want to talk a little bit about cyber criminals. And one thing that I found really interesting when I was doing research on this was that cyber criminals actually look for ePHI because it's rich with information. Essentially, what can be used and sort of what they're looking to commit would be identity theft, medical identity theft, tax fraud, obtaining loans or credit cards, sending fake bills to insurance companies, etc. And unlike credit card numbers, right, that can easily be canceled if compromised. Like if I lose my debit card, I'm just gonna cancel it, right? It's a little bit more difficult than that when you're talking about private health information, right? So medical health records really can't be altered and tend to last a lot longer. One report that we have here, and it's linked in here, says that Medicare numbers sold for nearly $500 a piece on the black market. So this is why it's super critical for all of us to make sure that we're taking care of the information that we're collecting. A few settlements that we found just recently, and you can see the pretty audacious numbers there. But penalties for non-compliance are based on a level of negligence and can range from $100 per violation up to $50,000 per violation, with a maximum penalty of $1.5 million per year for violations on an identical person or provision, excuse me. Violations can also carry criminal charges. So not only could your business be affected, but you could be personally held liable for the information that's out there. So you can see these aren't small numbers. Even $31,000 could really put a small practice, under. And a lot of the times, what happens is either it's ePHI, right? So they're not storing the data that they're correcting appropriately, and or it's paper forms that are kind of just sitting there and people can easily read them. So that actually happens quite frequently. So let's talk about some methods of collecting data now that we sort of have a better understanding of PHI, what it can do and why it's really important. There are really kind of 3 main methods that I see and kind of know of practices that are using. You know, my mom, for example, she worked for an endodontist, managing 8 different locations, and everything was on paper, right? So essentially, this could be a PDF or a Word document, or it could just be a piece of paper that you have somebody fill out. And you know, I'm not a part of a practice, right? But it's probably the most frustrating for the consumer end. You have to have a printer, right? If you're going to send me a PDF with all this information, you know, that can be pretty time consuming on my end. Not only is it time consuming on my end, but then when you're talking about the receptionist or the individual who's sort of entering this data into the system, you know, not only is that pretty arduous and manual, but also legibility is often an issue, right? Just reading people's handwriting. I know for a fact that when I'm going into a new chiropractor or a new office, I don't have the best handwriting, so I feel bad for those folks that have to go through and read that. But this is a pretty, I guess I would say, I guess from a money standpoint, it's probably the best way to go when you're talking about that. Although we'll get into it a little bit later, how digital forms can be cheaper down the road. Fillable PDFs. Sorry, I don't know what's going on with my screen here, so bear with me here. But fillable PDFs are kind of an easier route, right? We want to send these as securely as possible. However, they can be edited. So these are also you know, fairly commonly attacked by cyber criminals. But again, you need to have the ability to print. And then on the back end, the same manual sort of workflow process begins, where it needs to go to the doctor, it needs to go to, you know, whomever in that line, and it's all paper. And a lot of the times people blame other people for maybe losing information, right? Or the customer calls back and says, hey, we had a bad experience. So this leads to a lot of issues. And then what we have, I guess the last one, and there's digital forms. And there's quite a few companies out here that do a really good job of collecting data digitally. I mean, there are countless reasons on why this is beneficial, but the way that typically people are doing this are they're either going to send a link via email or have it embedded on their website. Another kind of traditional way would be to have an iPad, right, or a computer at your office where people can just conveniently kind of log in. It saves a ton of time. And then some form builders like Formstack, we can even automate massive workflows. So I'll get into that in a second, where we can kind of walk you through how that workflow situation works. So now that we have those kind of 3 pillars, and I'm not going to sit here and waste everybody's time on what a paper form looks like. We all know that. I think what's really important is to kind of get into this new wave, which is, you know, the power of digital forms and all the different things that you're going to be able to do, because they are a lot more dynamic than paper or PDF forms. So the first one that we want to talk about are millennials. These folks are now kind of coming into practices. So you see more and more in millennials in everybody's practice here that we're talking about today. They are used to having telemedicine or being online and Googling things. So it's a really effective mode of transportation for them just to utilize digital forms. So when we're talking about the older population, might not be the best. You might still have to do some paper forms for them, but the newer generation, this is the route to go. And we're seeing more and more health organizations go this route. One of the big concerns is physician burnout. A study that we looked at recently said 44% of physicians feel like they spend too much time working on EMRs at home. And an EMR, if nobody knows, which I'm sure you guys all do, but it's an electronic medical record system, right? And so what they're doing is they're manually taking all of the information that they're getting from the patient at the beginning or at the outset, and they're having to load that into an electronic system, which just takes forever, right? So they're spending over half their workday and they're not being as productive as they could, not seeing as many patients. So that's one big concern with sort of that other methods that we were talking about. So sort of filling the gaps and getting into, you know, how exactly digital forms work and sort of the dynamic properties around them. What we want to do is, you know, we're going to be able to reduce paperwork which obviously everybody wants to save the environment right now. I do. But not only that, just paperwork in general, right? Like filling things out, signing things, losing paper. I mean, we all do it. We do it all of the time. We want to ideally do less manual entry. No one wants to do that, right? If our customers can do that for us, why not just go that route? We can route the data, right? A lot of digital forms, not just Formstack, are going to be able to route the data into your EMR or safely into a system where you guys aren't worrying about potential cyber criminals. And then you want to improve patient satisfaction, not only with forms, right, or just collecting new patient information, but with surveys and things of that nature. And we'll get into that in a little bit and how you can really improve that area of your office practice as well. So the first one that we're going to talk about today is appointment requests. And this is something that we deal with on a daily basis. We have over 1,000 different healthcare organizations using us, closer to 2,000. But this is pretty common. The way that I always see this happening for myself, right, is the practice is going to go ahead and send that to me manually, or I'm going to have to come in 30 minutes early when I don't have, I'm going to have to fill out a bunch of paperwork, right? So we're going to go ahead and go back. Sorry about that. Appointment request. And I'm going to go ahead and bring this over. And what's really, really cool about this sort of form is that it's just multi-dimensional. So you can see here, this is where your medical logo would go. These are, by the way, extremely easy to make. It's not very difficult at all. But one of the cool things here is we can kind of take the scheduling process kind of out of the books here. So if I'm a new patient, you can request a time to meet with the doctor. But if you're an existing patient, what I really like is that it's going to automatically bring up the doctor's calendar. And you can use Calendly with Formstack. You could also use Google Calendar, a number of other different calendar apps that we have available. And I know other practitioners out there, other form designers can do the same thing. But what's really cool here too is once you get this set up, so we have 3 different hospitals. If I were to select North Shore Medical, I'm going to get one set of doctors. If I select General Hospital, I get a different set of doctors. And all of these doctors have their calendars right here. So if I'm an existing patient, I can easily get in here and add a time whenever they're available to meet, and then I'm done. That's on their calendar. It'll go on my calendar. This is the wave of the future. Instead of having to call, ask, wait on the line. I mean, there's a lot of different things that go on right now, whereas this is just one form, easy peasy, you're done for the day. So I think new patient registration is one of our most popular forms out there. Next, we're going to go ahead and look at a patient enrollment form. Why is this important? Well, again, what we want to do is enroll new patients. So that was an existing patient. But one of the big things that we can do here with form building tools is we can add file uploads. So for example, with Formstack forms, all of our forms are, they're mobile responsive. So they work on anything. Oops, let me go back. And what's cool about this now is that when we have the ability to ask somebody, or when we have the ability, if you're on your iPhone, for example, to ask for access into your photo library or into your camera, it makes it really efficient for folks just to take a quick snapshot of their insurance card and or ID or both and be done with it from that standpoint. So we have a lot of people using this type of form, and I'll bring it over here. This is Thrive, Alabama. And you can see it's just your generic form. I mean, this probably took them 5 minutes to set up. But again, down here, what it's asking you to do is to choose your files. So again, a lot of cool things that can be done with that. And then kind of routing the insurance information to where it needs to go afterwards. And seeing the submission data, you would be able to see the entire card on your end, which would be really cool. It takes a picture for you. You can save it as a PDF later as well, to put it in your EMR or whatever you're using to control your medical records. So a very, very good use case where people are using this all of the time. Next, I think what we're going to get into is online check-in. So again, I kind of talked about this a little bit earlier, but what's really unique about online check-in is they can do it at their own time and own pace. So you can even use like reminders, right? So if you wanted to remind somebody a week out that their appointment is coming, you need to fill out this form, it's a digital form, etc. That all can be done. Or you could have a tablet at the front desk so they could just easily check in, so your administrative staff can kind of, doesn't have to really worry about that. And then again, automatically routing data, and then we don't have any hassle with paperwork on the back end. Another unique form that we see a lot of the times in hospitals and smaller practices. So like, for example, maybe you are a psychiatric organization, or doing something where you're making diagnoses on people. And in this particular case, what we're going to be talking about is a depression rating scale for children. It's called a PHQ-9 form. And what's interesting about this is, and what's I think really neat, is we're able to take a form and put some really cool dynamic content on here. So for children, you don't want to bog them down with a bunch of questions and have a bunch of numbers, because it's just not going to be as efficient. It's much more easier for them to look at pictures, right? So what's happening here when I go through this form is there is a number or a score associated with whatever face I choose. So what's happening at the end then is they get their report, and it kind of tells them where they're at. It says right now, I'm mildly depressed. This isn't a clinical assessment, but what it does allow them to do is edit their choices. And then once they submit, this could go directly to the doctor and could actually help them make a diagnosis on this particular patient. It also works great with surveys. If you want to ask somebody about how their experience was or where you could improve, one way to do that would be through images like smiley faces. Again, hard to capture when you have just a paper form to fill out, when people really don't want to do that. But this stuff, you'll see millennials really like engaging in that sort of content. So I think that's very unique with our forms, and just kind of getting in, not just us, but other form builders out there as well can do that type of stuff as well. Just when we're talking about digitally, not only are we talking about how easy the process is, but how dynamic we can really make things. So we kind of got into this again, but the pain index for folks is, and sort of what's happening is the physician can add recommendations on the back end for medications. And then ultimately what they could do is push that to an insurance provider, or push that to wherever they need it to live at the end of the day until that assessment is complete. So it's just a tool in the tool belt of this physician that makes things a little bit easier. Referrals, this is another pretty popular use case through Formstack that we see with all of our medical organizations. What's really nice, what's really neat when you actually dig into the numbers here is hospitals lose on average about almost $1 million in revenue per physician per year due to referral leakage, right? Just like sending out referrals is not that easy of a process. I didn't know that until I actually started digging in here. So it was really kind of interesting. And then at the bottom there, you can see 63% of physicians are unhappy with the referral process due to inadequate information and timing. So really kind of interesting there. I don't know if that comes up with you all that much, but I kind of wanted to show you a process that Riley Children's Health out of Indiana University is using with us right now. So to make a referral, you can select a department. I know from my wife's experience too that this is a big pain. Like her primary needs to refer her to somewhere else, and they need to refer to, and literally the referral will get lost, or they never receive the fax or whatever. But on the back end here, after they filled out one of these forms, so let's say I need to refer somebody to audiology, right? They're going to create here, they're going to click make an online referral, and then all they need to do is simply fill out this form. And the nice thing for your offices too is this form doesn't look like a Formstack form. They don't know that it's a Formstack or an AdviceMedia form. It just looks and feels as beautiful as their website is. So I know that AdviceMedia does a fantastic job creating beautiful websites for you all to drive in new business. Let's make some of these more tedious, complex processes just a lot more streamlined and easier. Now on the back end, when this is filled out, you're going to be able to see all of the information. It can be pushed to the doctor or whomever via email. And if they haven't picked it up, well, guess what? You're going to be able to see and hold people accountable on the back end. If it's paper, you really can't hold them accountable. Well, I sent it. Well, did the fax work? How many times do you all hear that? This completely removes that process on the back end. So I think that people really enjoy that. We see this as one of our most common use cases, is referring a patient. Another really popular form too that's impossible to do with paper or PDF is multi-language forms. Okay, so we have a Google Translate embed that you can easily put in. And by the way, as I'm talking about this, you all, I am not a technical person at all. So when I'm building forms in Formstack, it's about as easy as 1, 2, 3. We show you how to do it. You just embed the code. It's really that simple. It is not complex. I don't think that you're not going to be able to do this because you don't have a degree in marketing. That's not the case. But just doing some research, more than 20% of U.S. residents speak, a language other than English. All right, and not to mention all of the foreign residents or all of the folks that are coming here for vacations and travel, etc. So you may have this this happen quite often. And what we're able to do here is we have a form. And this is just a random form that we have here, but you can see that it's natively in English. So instead of, maybe you are in Texas or you're in California where you're going to have a strong percentage of the population that is going to speak Spanish, instead of having multiple forms for multiple languages, they can select the language that best fits them at the top. So if it's German, right, we select German, and then boom, the entire form translates into German, including the terms and conditions at the bottom. But even if you are right now just collecting contact us information, you are potentially putting out there a liability for EPHI to come in to your office. So think about that. If we're even collecting general information here and we have some sort of contact us or comment box, they can put all sorts of information in there. I've seen people, or have read cases where people have gotten sued for that as well. But getting back to having the Google Translate option there is phenomenal. And obviously these look cleaner and every single time they're legible. So multi-language forms is another biggie. Next, we're going to go to post-operative surveys in general, right? So we would want to typically, sort of the best practices here is, no matter if you're doing paper forms or if you're going to go digital, you're going to want to send out your appointment, your surveys about 48 hours is kind of best practice that we've seen across healthcare. And that's coming from word of mouth. That's also just looking at the numbers. You want to keep all of your surveys short. I know that we find, at least with our forms, we can see where people are falling off. And a lot of the times, if it's more than 1 page or if it's more than 5 or 6 questions, people aren't going to fill it out. And then you want to make sure that the questions are digestible and they're user friendly, right? Let's not make all sorts of crazy questions where people really aren't going to feel comfortable answering those. So now we're going to go into what a survey looks like here. And this is kind of a cool one, but just something to give you kind of an example. Please rate your overall experience. You have just a little bit of a radio button here. Would you return again? Yes, no. What could we have improved? This is where you got to be careful when you're using Formstack. We're held liable for the information that we're collecting because we have a HIPAA-compliant solution. But if you're using just WordPress or whatever you're using currently and you don't have a HIPAA-compliant solution on the back end, this is, what could we have improved? Well, you could have improved, the soreness in my ankle. Well, soreness in my ankle right there is EPHI. So we've got to be as careful as possible with that. And obviously providing additional feedback, but just a simple, quick form like this, I know BU gets a ton of usage out of that as well. So that can be a nice integral part of your new business process. And then next, rate my doc surveys. Again, we're talking about millennials here. 75% of millennials look at online reviews before choosing a physician. 75% of millennials. So guess what? We're going to want to ensure that we're doing an outstanding job, which I'm sure all of you are within your offices, but also we're going to want to make sure that everything was as seamless and as user-friendly for them as possible, right? And then collecting that information at the end. So typically the workflow you'd see would be, you know, the patient completes a survey, info is sent to your staff or to the physician. At the end of the day, then each staff member signs off on the form that you're going to have, and then physician uses feedback to improve your office setting. Instead of having a box, right, which most people have right now probably with paper, and you just, you know, put your comments in there. This is something that could automatically be sent out via email to everybody that came into your office. So very important, again, for those millennials. A little bit about Formstack. So we've kind of wrapped up everything that we're going to talk about with the forms. Now, I will tell you that there are some hospitals with us that use us for 1,000 forms, more than that even. So the possibilities are really limitless. But your average sort of organization is probably going to use this for about 10 forms. When you do partner with Formstack or you use Formstack, right, we exceed HIPAA compliance. We go through a HIPAA compliant audit every year. We do one internally quarterly. We encrypt the patient information for you. Formstack is taking on liability. We also reduce a lot of your heavy administration costs, and you know, you can kind of have that peace of mind knowing that you're going to be able to avoid those internal and external threats. All of our information that we collect from a patient health information standpoint is held on separate disk encrypted servers. They're all on Amazon servers. So it's not held with our general population, like you know, the National Hockey League information. They are not on that particular server. And then for everybody joining us today, I'm sorry about this. This slide isn't showing up for whatever reason, but Formstack and AdviceMedia have a promotional pricing opportunity here. Retail pricing for Formstack is $350 per month. But through this particular deal today, if you wanted to kind of digitize your forms, AdviceMedia, if you want to talk to your customer rep there, we're going to go ahead and do it for $150 per month. So you're going to be able to save $200 per month, digitizing your online process. With that, I want to thank everybody for their time. I know that we probably didn't hit the maximum. We spent about 30 minutes talking about all this stuff. Really appreciate it, and I'm open to any questions that anybody has.
Jake, thank you very much. Really appreciate it. It's it's amazing because there's so many offices that I see on a regular basis that are out of compliance in the way that they're presenting their forms to patients, and they operate under the assumption that regular email is compliant as well. And you can do some messaging through there, but it's when you get into that secure data, it's actually health data that they open themselves up to potential liability. And so this is a great solution for that, and eliminates most of the issues that offices run into. So thank you for talking about this need. Several questions, and if you have any other questions for all of our listeners, again, I invite you to put those on the question section on the GoToWebinar control panel. One of the first questions that came in is this slide deck, are you able to make these slides available to all of our participants today?
100%. So these will all be available for everybody. We'll make it a PDF where you can click around and play with some of the different things that we're able to show you. All of the statistics that I provided today as well are from documented resources. You can go in there and read a little bit more about that as well.
Perfect. So one of the other questions was, how many forms does an average practice use? You mentioned 1,000 or so, some of these large hospitals, which is normal. But if you're a normal small practice, 1 or 2 physicians, how many typical forms do they need to cover their security and HIPAA issues within the office?
Yeah, we're seeing about 10. It kind of depends on what sort of practice you're running. For example, I work pretty closely with a partner of ours that sells into orthodontists, and they have about 9 forms on their their package. But with AdviceMedia, you get 20 forms with that $150. Our regular customers get 10, so you're going to have more than enough. But realistically, anytime you're collecting any sort of data that could be considered EPHI or has the ability to, right? When we talked about that contact us form, and leaving comments, those are potential liabilities for people to leave that sort of information where we have to be protected. So typically, I would say about 10 is probably the average.
About 10, awesome. And then how easy is it to tie these forms into an EMR? Is it actually, the question is it possible to tie them automatically into the EMR to avoid double entry?
Yeah, so definitely. We're working on a lot of those connectors right now. It depends on what EMR you have currently, but where it's residing right now in Formstack is completely 100% safe and encrypted. The way that folks are doing it right now is either they're using our API, which Chad, we can talk about a little bit later, some of the most popular EMRs and possibly how to connect those, or what they're doing is they're taking the submission data and we have export features where they can export it seamlessly into an Excel or CSV file and get all of that data right into their EMR. That's the way most practices are using it right now.
Excellent. Let's see, the other question was, you talked about how easy it is to create a form. How easy is it if they have to update a form after it's been created?
Extremely easy. It's the same thing. You're just going, it's all drag and drop. I know we didn't talk much about our form builder today, y'all, but essentially it's just drag and drop. So you're going to bring things over and then edit them as needed. I edited the form today. It took me about a minute to add in those file upload features, and I was done.
That's good. And maybe a question that's a follow-up for me is if that form gets recreated by the client or by somebody else, does it have to be re-uploaded to the website, or does it recognize automatically it's been updated within the URL?
Good question. It's automatically updated, Chad.
Oh, that's really
nice.
The
other thing too is if you have digital forms right now and you wanted to go with this offer with Formstack and AdviceMedia partnership here, it would be pretty seamless you don't have to recreate your forms. If they're HTML, you can just automatically throw them in and upload them to your system and then kind of maneuver them around after that. And that takes about a minute or so.
Perfect. One of the other questions that came in is, can the surveys be used for staff member ratings as well?
100%.
Yeah. So it's not just for the doctors.
Yeah, exactly. This isn't not just an external tool, right? You don't need to just use all of this for your customers, right? A lot of this stuff can be used internally as well. People are using this for all sorts of different. You could run your entire practice off of Formstack, and some people are, right? Where they're taking, all of their, they'll do W-9s, job applications, etc. through this, as well as those different ratings. Surveys internally.
Awesome.
Mm-hmm.
Let's see. Maybe one of the questions I have, and thanks everyone. Those are great questions. One of the questions I have is, why are they still using paper forms? What holds them back? You talk to people all the time, so why are they still using paper in their practice?
Yeah, that's a great question.
I went to my doctor the other day and I had to use a paper form, and I'm like, why am I still filling out paper?
Yeah, that's a great question. And it just kind of being old school, really realistically. And change can be scary for some folks. And it's not just in healthcare, right? We're talking about I just went to the YMCA, and we work with a lot of the YMCAs, but when I filled out my application to join there, it was paper. It's ridiculous, right? And so what it is a little bit of fear, a little bit of change, right? And so I feel, and people are kind of coming into it right now, right, Chad? Like, some people don't even have a website. You get a website, now you're in the 21st century. Now that next logical step is to let's make all the other processes easier. Let's go with digital forms. Like I said with my mom. She's in her 70s, but when she was running that practice, they were running everything off paper, and they were looking for a solution with digital forms for their 7 different endodontist locations as well.
Yeah, it makes sense, and I think there's a liability with paper. if something were to happen to the paper, you know, in the office, or you have double entry as well, then that's certainly an issue.
Yep.
One of the questions that came in, and maybe I'm not understanding it correctly, is they said, is this similar to PCI HIPAA?
So PCI compliance and HIPAA are two different things, right? HIPAA compliance has to do with, you know, like we had mentioned earlier, we've been talking about HIPAA compliance. PCI compliance has to do with credit card information. Does that make sense,
Yes.
Chad? So it's all,
yeah.
So it's basically the way that you store credit card data is PCI. So we are PCI compliant. We're going through our audit right now. We'll be compliant by the end of the month.
Yeah, and we have to do the same. We go through PCI compliance here at our office as well, and constantly watching that. So, and we have our audit team in here right now, so we understand that. So, just helping our user understand is
yep.
PCI. So they're both in a compliance realm. They're just different. One for the credit card data. One is for the health information. I hope that helps you answer your question. Yeah.
Yep. 100%.
And then a very specific question is: do you integrate with EMRs like Eyefinity? I don't know if you know Eyefinity, if you know off the top of your head.
So again, we have a lot of integrations, and I can just show you here quickly. I'll kind of dive into this tool here for a second. I want to kind of go back to that question about making a form or editing a form. So here's a form, right? And let's just, this is our healthcare demo. We're talking about this follow-up survey. To edit, you just go build. And let's say I wanted to, this is the survey that we looked at with BU earlier. Let's say I wanted to add a signature component. All you're going to do is drag and drop that signature component over, right? And then if I view the live form, that same form that we looked at now has a signature, right? So I answered that question. Very easy. Secondarily, integrations, right? So when we're talking about integrations, I don't think we have that particular EMR integration. All right, I'll be honest. I don't think we have that one right now. But we just launched Bedrock Data. We have a lot of these newer sort of integrations just came out today. But if we don't, we have an API, and we can easily build a webhook in there. But a lot of the times what people are doing, again, just to kind of get back to that, we might not have a specific integration right now, but what they're going to do is they're going to take their submission data right here, and there's an export feature. You're just going to export that data to wherever you want it to go. It takes like a minute or two.
And there's just a usually matching up fields on a spreadsheet with an import, then, correct?
Yep.
Got it.
Exactly.
So pretty slick. Another question came in is and I don't think you do, but do you offer insurance for cybersecurity?
Insurance for cybersecurity.
You're not an insurance group at all, from what I understand, correct? Just on
we're not insurance forms. Yeah, just HIPAA. What we're doing is we're taking on liability for all of the data that you're collecting, right? So basically, we're signing a BAA or a business associates agreement with AdviceMedia, and through AdviceMedia, you're getting this deal. Well, you have a BAA with them. Boom, we're taking on the liability. And a lot of the other form builders out there aren't taking on any liability, whereas we are. And that's kind of why the price point is what it is because as we kind of talked about earlier, when you're looking at a potential lawsuit of $50,000 per person, you know, it gets up there, and we saw some of those numbers before. It would be incredibly bad for us if that were to ever happen, right? So we try to, and we always adhere to the strictest policies when it comes to data collection. But I don't think, no, we don't do the insurance portion. Yeah, and then asking again, if there's a cyber attack, to get your files restored, but there's really is that really an issue for you with the way the forms are sent over? No, that's never been an issue. Yeah, so the files and restoration really has to do more, and you know, you asked me about ransom. That really has more to do with your EMR and contacting your EMR company. It's unfortunate. It's absolutely something that's plaguing groups today. So yes, we think about that heavily and what goes on. And it's very, very frustrating on the EMR side when there are cyber attacks and there's a ransomware. And so
I know that it's been a hot topic of discussion, just answering this person's question at a lot of the conferences I've been attending recently. I know that it was, they had an FBI agent actually come and speak about cybersecurity at the International Society of Aesthetic Plastic Surgery in October, and so I think you're going to continue to hear more and more about it. So the security of this data is absolutely critical. This is one aspect of that helps protect you and in the long run, but there are other things that have to be done as well, and a lot of that's with your EMR. And if your EMR has been hacked, you'll really have to talk to them. And so then the question on top of that is, do you store our data in the cloud?
Yeah, so it's all on Amazon Web Servers, right? And one thing about us and Amazon is we've never been hacked or breached for anything, right? We've been around for 13 years. And again, we're talking with smaller practices here today, and we work with plenty of them, but we work with the 3 largest hospital networks in the United States, right? So we're storing a ton of EPHI. It's all secure. And again, it's because we take all these measures, and it's because what we pay for Amazon, it's because of all of that, that we don't really have any issues with this. So guarantee you, if you go ahead and move forward with this Formstack offering, you're going to be excited, is you're going to digitalize a lot of your potential, tedious and mundane tasks, but you're also, you're going to get the highest level of security that's out there.
Perfect. Great questions, everyone, and Jake, thank you.
Yeah,
we really appreciate everyone's attendance today. We hope that as we head into March, that you continue to have a wonderful and strong spring season, that you continue to experience wonderful success in all of your practices. Jake, thank you for your time today and for your presentation. I'll get that slide deck from you, and then I will, for everyone that's on here today, I'll send that out to you so that you've got a copy of those slides for later on as well. But again, we thank you, all of you, for your participation, for your questions, your attentiveness to the information we have, and again, wish you all the best. Jake, thank you again.
Thank you so much. Yep. Bye, everybody.
Goodbye.